Hi guys, Dr. Jesse Broderson from Malama Chiropractic. Today we're going to talk about tension headaches. This is a common headache that comes into my office. It actually occurs in about 20% of the population as a whole. I want to show you the treatments and techniques that we use in the office to get really good results with a tension headache relief. It's actually called a cervicogenic headache. That means it arises from the neck. So usually there's a neck or an upper back component. So there's going to be some neck pain or maybe some tightness of the shoulder muscles and neck muscles. So the first thing that I'm going to do is just evaluate the area. Shannon's here with us today, and a lot of times I'm going to find tightness in these upper shoulder muscles here, the trap muscles, the muscles of the back of the neck here. I'm even going to check the muscles on the skull. All the muscles that, are for facial expression, our smiling, our enthusiasm, our sadness, those muscles can actually get tight as well. So if I find tight areas, I'm usually going to just contact there, have the patient take a few deep breaths and really try and loosen up that tension. Next thing I'm going to do is do some massage work with a vibrocussor, just to loosen up the bigger muscles that I'm finding that are tight. Let me show you what that looks like. So I use this handheld massager. This is called a vibrocussor. This is just a great way to loosen up the tight muscles of the back and the neck and the upper shoulders here. Usually just feels real good. Allows the patient to just kind of focus in on the tight areas that they're feeling. And I usually just have them take a couple deep breaths as I do this. We really want to provide an exit for the tension in the shoulders and the neck. The next thing I'm going to do is do an adjustment with this instrument called the arthrostim. This is a great way to encourage joint motion, but also stimulate the receptors and override the pain and dysfunction signals that are getting communicated from these subluxated areas in the neck and the upper back. A lot of times I find subluxations in the upper neck, usually the first couple vertebrae at the top of the spine there. Sometimes they're subluxated lower, but a lot of times it's associated with the upper cervical subluxation. Now I'm going to do a manual adjustment on the subluxations that I'm finding on Shannon. Not everybody is a candidate for a manual adjustment. Shannon is though, and so what we're going to do here is maybe a little tender on that one there, Shannon.
Yeah.
Okay, so you just let your head relax here. Good, and I'm going to give you a little bit of a bend and just a little push. Okay. Good, and one more time. Okay. So we got some really good releases there. I'm probably even going to end with just a little bit of trigger work just to make sure that those muscles don't tighten back up on her. Now I've got her adjusted. I've got some of the muscle tightness under control. I'm going to use some essential oils that are really good for relieving headache, tension, and pain. So I'm going to just have you hold your hand out like that. Good. Put a drop of that there. And then a drop of... I'm going to use peppermint and lavender. And just go like that on the back of your hands. Okay, good. Okay. So I'm going to be setting her on some therapy. And while she's doing this, she's just going to be doing some aromatherapy on herself. So now I've connected her to some electric muscle stimulation. I've put the pads on the tight areas that we are finding in her upper back and her neck. I'm going to have her lay down on an ice pack now.
Good?
Yep. So we're going to run this for about 10 minutes, and I'm going to have her be doing the aromatherapy, just taking a few deep breaths of the essential oils every minute. Okay, so now that the treatment's done, I'm going to go over a few things with the patient that I want them to do at home. The first thing I'm going to have them do is drink a lot of water. It's important to hydrate the body. Also, they're going to continue to use ice at home, and ideally just go home and lay down for a little bit. I'm also going to put a biofreeze on them, which is a pain relieving gel that we use. So this is just a nice way to continue the treatment and the pain relief. Just go like that. Okay, good. So I hope you found this information helpful when it comes to treating headaches. If you're dealing with a headache, give us a call and see if we can help. Visit malamachiropractic.com for more information on our products and services. You guys have a good day.